A professional counselor in the Dallas area is growing in popularity for his treatment methods.
How do you talk to kids about terror? And with social media and television, it's everywhere, and it's unavoidable for kids.
Rusty Lozano is the founder of the Center for Biofeedback and Behavior Therapy. He's also been nationally recognized for his work with brain mapping.
He's created a gym to work out the mind. His office features an obstacle course.
Rusty Lozano is a licensed professional counselor, helping children with headaches, with anxiety, ADHD, and more.
Here's where Lozano comes in. He teaches kids how to think their pain away with something called biofeedback.
A North Texas therapist is treating patients in this unconventional way.
We have Rusty Lozano who's joining us today. He's a licensed professional counselor.
He put together an unusual treatment for teenagers who are struggling with mental issues, except he's taking this now a step further.
Rusty Lozano, a leading therapist and pediatric biofeedback therapist based in Texas at the Center for Biofeedback and Behavior Therapy. And Rusty, thanks for being with us tonight.
Rusty Lozano, a father of 4 and also a professional counselor in Texas, says it's all about being a credible resource to your children.
The Therapy Hour with Rusty Lozano, your dedicated resource for mental health news, views, and tips you can use. Brought to you by the Center for Biofeedback and Behavior Therapy in Addison, Texas. And now, here's Rusty.
And good afternoon. Thank you for joining us on the Therapy Hour. Boy, the weather certainly has changed. We are in a really cool time of year now. So it's you hear the echo is gone. I was like, what? It sounded like I was in a cave for a minute. The weather just turned, and it's actually really nice outside, and wow, I love it when it's like this. We have a really great show today. This is something that I was telling one of my patients this week, who is struggling with back pain, and when he and his daughter come in, he has a morning routine of stretching, this routine of kind of loosening up his back and trying to get some relief, and it happens every day. And he says he has to sit up in a certain way, like propped up with his body on one of my yoga ball chairs. And so I told him that he should really chime in, because this actually affects quite a bit of people. It's chronic pain when it comes to back pain and neck pain, and a particular approach is actually growing in popularity and becoming more relatively known. So I'm going to give you a little intro to chronic pain. So chronic pain is defined as the pain that persists for greater than 3 to 6 months, and currently affects roughly 30% of the population in the U.S. The most common method for managing chronic pain has traditionally been pharmacological. These treatments often include non-steroidal, anti-inflammatory drugs, opiates, acetaminophen, injections, and the anticonvulsives. Alternative medicine is also being used to treat back and neck pain, more frequently chronic pain, that may consist of more acupuncture, biofeedback, and then low-level laser therapy, which is our topic today. So low-level laser therapy, how it's actually used for chronic pain is it augments levels of nitrate oxide, a powerful vasodilator, which would in turn increase blood flow and assist with healing, which is really interesting because blood heals. And, the whole idea of non-invasive, not having to be cut into, I think it kind of, it's alluring to a lot of people.
Yeah, that's what defines laser therapy, although there are different kinds of lasers, including more the traditional ablative lasers that are not low-level laser therapy.
Mm-hmm.
They're much more powerful, but they're much more tunable, can cut into skin. You can cut with it, or you can do procedures like for snoring and sleep apnea without cutting anything.
Yeah.
And improve them. And that's a whole different ball game. And those everybody is running out and getting aesthetics procedures done for facial and body contouring and skin tightening and all kinds of other reasons for doing cosmetic laser work. But the idea of using high-energy lasers for chronic pain, chronic joint pain, chronic neck, back pain, even headaches, migraines, chronic snoring, sleep apnea. These are all problems that affect about 100 million people in the country at any given time. That's a whole different, newer way of looking at laser therapy.
Mm-hmm. Because it's actually it could be used without the medications, pharmacological, or used in conjunction with
medication. Nothing countermands medication. In fact, the lasers that I've gotten involved with actually stimulate the production of collagen and lymphoblasts. And lymphoblasts are your source of cytokines, anti-inflammatory, pro-inflammatory mediators that swim around in our bodies and our brains and take part in all kinds of promotion or reduction in chronic pain. So we don't really have protocols yet for dealing with different pain issues, but hopefully those will.
Yeah, it seems as the technology improves, then the entire arena opens up for what the possibilities are.
Yeah, it's a whole new way of thinking of approaching pain. But one thing doesn't countermand the others. You can still have traditional surgical techniques. You've got interventional pain management, which often uses injections and morphine pumps and spinal cord stimulators. And then you've got the whole pharmacologic arena. So it's not just about pain medication, which a lot of people tend to simplify pain management into.
Well, I think that opiates are now a huge topic in this country, and how often they're prescribed and how often people are taking them, and how concerning that is.
Opioids are not the enemy. The misuse of opioids.
Right.
You can kill yourself with water by over drinking water.
Sure.
You can die. So.
But then water is not necessarily addictive, though, and.
Well, no, but addictions are about behaviors. Addictions are never about the medication, ever.
Mm-hmm. Yeah.
And that's where people get those terms confused.
You think that people that, and this is a little off topic from low-level laser therapy, but I'm just curious, I'm talking out loud, but with the level of distress and discomfort that an individual feels when they do take medication, when they're trying to function, we have obviously some resilience and resistance levels that you can tolerate to carry on a day-to-day living activities of daily living. But do you think that when people maybe go beyond that threshold, or they just get a little bit tingy, that's when they rely on the meds?
Well, consider that 80% of people who live with any chronic disease are anxious and depressed.
And
they don't sleep. They don't rest their brains. If you don't address those three fundamental issues, you're not going to see anything improve.
Sleep.
So, sleep is hugely important.
Yeah. And you have to think also that an individual who lives with a substantial amount of pain, it's hard to be polite. It's hard to be patient. It's hard to be at your best because, what you're experiencing is coupled with pain, and obviously it's very uncomfortable. So
you're
likely
not the
to
same
see,
person that you were before the chronic pain.
And then that's probably what leads a lot to the depression, is that you're seeing
anxiety, fear,
low-level frustration tolerance.
And they'll miss out on family events because they're miserable.
Yeah, big time. I think that's something that's really important for people to understand, that there's a cycle to how symptomology actually affects a person's life. And living with chronic pain is not a simple. I mean, I'm virtually pain-free, and knock on wood, but living with it, I've seen with my own eyes, I've experienced it here at my clinic, how it really has an effect on people's lives, and missing out on parenting, not being able to play with their child, or not being able to work.
Right, and I'm not pain-free. I live in pain 24/7. I don't take a single opioid at just about any point in my life, and so but I've been trying to meditate for 45 years as well, and that takes you up to a point. I still don't feel I have it right. You can always do it better, but
yeah,
it is what it is.
Well, and you kind of learn to adapt and know what your limitations are and work within those. And,
a lot of compromises.
Yeah, and you're still trucking because you have your clinic and you also have this new venture that we're going to get into and talk a little bit about.
We'll talk about that.
Yeah, but let me introduce our players because we just jumped right in. Joining me today is Claude Krusz. He's the director of the Anodyne Headache and Pain Care and Wellbeing Center in Dallas, Texas. Also joining me today is Jessica Riva. She's a speech and language pathologist, pediatric speech and language pathologist here in Frisco at the Speech and Feeding of Frisco LLC. So with a minute left before we have to take a break, I want to welcome you guys to the show and maybe just feel free to chime in as we kind of move into this topic because it's huge. There are so many different varying levels of pain conditions and living with pain, and this treatment seems to offer another alternative that maybe people have not really heard about, but it's super important to know. And I think that's where we're going to be able to shed light and see where we go, as far as maybe providing some centers or some locations that may offer things like this. So we're going to take a quick break. When we come back, we will resume our show on low-level laser therapy. We'll be right back after these messages.
This is Pete the Fast Greek, host of Race Talk, the motorsports talk show, heard every Sunday live from 4 to 6 p.m. right here on Talk Radio 1190. When the races are over, we're just getting started with the latest news and results from NASCAR, NHRA, the IndyCar Series, and what's going on right here in the Dallas-Fort Worth racing scene. So join me, Pete the Fast Greek, every Sunday live right here on Talk Radio 1190 from 4 to 6 p.m. for the latest in the world of motorsports. And remember, keep your racing on the track, not on the street.
Come with me on another journey around the globe.
From National Geographic comes an all-new 6-part series with Morgan Freeman.
Searching for answers to humankind's biggest questions.
How can you hate me when you don't even know me?
Meeting inspiring individuals from all walks of life.
When people see someone helping another person, I think it's infectious.
This is what it means to be human. This is the story of us.
The Story of Us with Morgan Freeman premieres Wednesday at 9/8 Central on National Geographic.
We believe that the best Halloween ever is yours for the taking. That's why HalloweenCostumes.com/iHeart has over 10,000 costumes, including 2,000 made exclusively for you. Your favorite movie, your favorite artist, your favorite food. We have them all, from video games to fairy tale princesses, in sizes infant to adult 8X. 10,000 options await you at HalloweenCostumes.com/iHeart. And why HalloweenCostumes.com/iHeart? Because we're partnering with them to get you 15% off. Go to HalloweenCostumes.com/iHeart and own Halloween.
You're listening to the Therapy Hour with Rusty Lozano, brought to you by the Center for Biofeedback and Behavior Therapy in Addison, Texas.
Hi, and welcome back to the show. If you're just joining us, we are discussing low-level laser therapy and its approach for the use of back pain and neck disc pain. I think that you and I had a conversation about this, but let's define what LLLT is, Jean-Claude.
Okay, low-level laser therapy is just that the power outputs are extremely tiny. They don't penetrate the skin very deeply, and they're FDA approved. And there's many different competing types of low-level laser therapies out there, but they're typically used for sports medicine type problems and acute injuries, and are really another worthwhile alternative to taking medications. They certainly can complement meditation, biofeedback, and other non-pharmacologic methods of treatment and control of painful issues. But if they occur on a day-to-day basis or occur over a number of years, then either somebody hasn't worked up the source of the pain as well as they might have, or some other approaches can be thought about.
Yes. Let's talk about this. How does it work? How does a session of LLLT, what does it look like?
Well, again, I know less about low-level laser therapy since what I'm involved in now is more high-energy laser work. So the principles are totally different. The problem is that very little is published in terms of what these therapies do. People talk about promotion of blood flow and this and that and just a lot of things, but ultimately I'm trained as a scientist, so show me the money, show me what's been published, what can you speak to scientifically, and the same is true, even more so, for the so-called high energy adjustable dual laser type technologies that we've been looking at recently. There's nothing published in terms of protocols. I can tell you individual stories, but that doesn't make a double-blind controlled study in any way, shape, or form.
Mm-hmm.
The low-level laser therapy tends to stimulate blood flow. Yes, there is some data for that in animals, mostly, not in humans.
Yeah.
And again, the higher energy, like when you're doing so-called cosmetic lasers that tighten skin and get rid of wrinkles and do all kinds of things, have been shown to increase the production of collagen, which we all lose. By the time we're 30 or 35, we're down to half the collagen that we had when we were kids. And by the time you're older, the numbers get smaller. So if you can stimulate production of collagen in turn means also stimulating production of fibroblasts. Fibroblasts are factories or cells that produce what we call cytokines. And cytokines come in two flavors, anti-inflammatory and pro-inflammatory. And the anti-inflammatory ones are the ones that we want to maximize. And I guess to some extent low-level laser therapy also would probably have an effect there as well. But there's a lot we don't understand about mechanism of action.
Right. So the increase of cytokines, especially the anti-inflammatory type, I imagine what this would look like is a person would likely lay down, they would find a target site on the back, and then they would stimulate.
Well, they wouldn't do this themselves. This is
no, I know they would get it done, right? This is what it would look like
unto you. Now, some of the low-level light laser therapies can be self-performed at home, as I understand it, but most of them are actually done in clinics and practices, and are administered to the patient.
Right, like it's like a treatment.
It's a treatment. Yeah.
Right.
And so again, depending on the extent of relief, the degree of relief, the time course of relief, these can vary tremendously. And we don't certainly know what these other types of lasers are capable of doing, since protocols are just being kind of thought about and looked at.
Yeah. So how new is this, Jean-Claude, that they're doing this they're exploring this for back pain? And
well, it's not that new actually. Lasers were the laser light amplified modulated. The term laser is an abbreviation for emitted radiation. Light amplified modulated emitted radiation was first invented in 1960. The machine that we're looking at actually began production in Europe in 1964. So this stuff has been around for a long time. For a long time, we had very high-powered lasers for cosmetic use called CO2 lasers. Now we're using erbium, ERBIUM, which is a natural element, and also using neodymium, NEODYNIUM, and they're all both paired with what's known as YAG, capital Y, capital A, capital G. So it's a dual laser with a lot of focus and control into how much power it emits and how deeply. I mean, you could cut somebody's eye from 5 miles away.
You're saying that.
With the laser, if the appropriate filter is on the handle.
Jeez. Wow.
So these things are not, toys to be played with. And they accomplish phenomenal things as far as laugh lines, and I've had some little skin things taken off, skin tags, and we're looking at it for sleeping and snoring currently. There is a protocol for that.
How would you address it for sleeping? Curious.
Well, I mean, to describe the procedure would take up the rest of the show.
Oh, man, we should have made the show about that.
But
that sounds really interesting.
Yeah, it could be a separate topic. But it's basically done inside the mouth on the soft palate and also on the arches and the pharyngeal pillars. And there's no cutting involved.
That's what I was wondering about. I mean, for what does a treatment actually look like? Is using the laser therapy to kind of reduce pain, say, for example, does that mean that they're cutting into the skin? Are they making lesions?
Well, we are making surface lesions, sometimes 3 micrometers, sometimes 4 or 5 micrometers, depending.
And would that be equivalent to like a little paper cut or a scratch?
Oh, no, much thinner than a paper cut.
Oh, so really surface level.
Very surface level.
But then what happens is the laser penetrates beyond the surface tissue and...
Well, for instance, if you're melting fat, doing liposuction, you actually melt the fat cells, and then you use a skin tightening procedure to be able to remove the melted fat cells, and that's how you do facial tightening or skin wrinkles or upper lip or lower lip or laugh lines, crow lines. But that's the typical aesthetic cosmetic use of these lasers. That's very different from you thinking about it for chronic pain issues.
Yeah. So what would it do then? I mean, so I'm trying to put my hands around like what this would, what a treatment would actually look like for somebody who's going in with severe back pain or severe neck pain.
I can't speak to that because I've only done 2 people with necks so far in terms of trying to help them. And
how was the outcome for that?
Well, the one outcome I did in Colorado about a month ago, a lady had a tumor in her neck that was removed. It was a melanoma. And she had this ugly scar. And for 14 years, she had daily neck pain, daily pain in her trapezius muscles and between her shoulder blades, along with what sounded like a migraine or a migrainous type headache. And again, 14 years, I was doing some training on the same machine that I'm looking at here in Dallas, and we did just an arbitrary run of taking a different procedure that's used for body sculpting and skin tightening, and we just turned the power down, and we ran it for 12 minutes between the shoulder blades, the base of the neck, over scar tissue, over her traps. And the last feedback I have from several days ago is that the lady still hasn't had re-onset of her daily neck pain and daily headaches. Now that's
so you've kind of repurposed like a high energy level laser and dampered the filter some to kind of use it for a different approach.
Right.
So this is really in its infancy then.
Well, it's very much in its infancy, yeah.
Interesting.
Yeah.
Wow.
Only did my second patient this week, a patient I've been treating for 20-odd years who's got neck and chronic migraines, and we'll see if it extends some of the injections that I typically do for her on a monthly basis. We won't know for a month.
So the things that you're doing, like the approaches, you're kind of using more instinct like where to target these areas?
Well, I mean, it's learning a lot of physics and learning things that I wasn't trained in to try to modify the cosmetic use of these lasers, the aesthetics use, and think about treating things like TMJ, joint pains, chronic arthritis.
So you're collecting
back.
Yeah. You collecting data with that and like
no, I have no data whatsoever.
Yeah, man, that sounds like a fascinating study.
Yeah.
You know,
well,
a lot of potential
hopefully
there.
It could move the field forward. It may not. I don't know.
Yeah, it's very, very much an exploratory. But I want to I do want to talk more about the one patient and what she reported for how it affected her pain.
Well, I haven't reported. This is all by her report.
Yeah, by her report.
Yeah.
Like, you'd said something like, she'd seen some improvements.
Yeah, for about a month now, 5 weeks. So we'll see how it lasts. I've got a dermatology colleague in Denver who did some training with us, and he's going to probably do her again when her headaches and pain start to come
So you're
back.
working with a team of other physicians. And
yes, I'm partnering with a plastic surgeon here in Dallas who does a lot of, he does cosmetic and aesthetics, but he's also does a lot of nerve entrapments, carpal tunnels, amputations, a lot of scar pain.
Interesting. Well, we're going to take a quick break, and we're going to learn more about that as soon as we come back from the break. Be right back, guys.
Free Talk Live.
Put up a barrier on the border.
Like a Great Wall?
I think that's secure. And then you put a moat underneath.
Holy crap, alligators in the moat?
You can put sensors on there. The motion detectors.
Motion tracking machine guns, too. Just spit out some 50 cals at them if it moves.
I mean,
ninjas, that's what we need. The border ninjas.
Catch Free Talk Live Monday through Sunday, midnight to 3 a.m. on Talk Radio 1190.
Do you hear these My Computer ads and think, yeah, that sounds great, but I don't know the first thing about computers? Well, that's okay. Many of their graduates could do little more than turn their computer on and off when they started classes. Now, they're IT professionals. It's not rocket science. It's My Computer Career. See if IT is right for you. Go to mycomputercareer.edu and take the free career evaluation today. My Computer Career is where you get trained for the high-demand field of information technology and start your new life in as little as 3 to 4 months. Attend classes on campus or live online just twice a week to get what you'll need to start your new career. More than just a school, My Computer Career helps you get into the industry by working with hundreds of employers that hire their students. Financial aid is available to those who qualify, including the GI Bill. Classes start very soon, so take that career evaluation now at mycomputercareer.edu. Still haven't gotten your tickets to Freakers Ball? From now until October 13th, spend $100 at any Pep Boys location for any service or merchandise purchase and receive a free pair of tickets to the spookiest show of the season. That's right. Spend $100 at any Pep Boys for any service or merchandise and get a free pair of tickets to Freakers Ball while supplies last. Whatever the service, the boys have you covered. Trust the boys to get you there and visit PepBoys.com to find the location nearest you and get your free Freakers Ball tickets today.
You're listening to the Therapy Hour with Rusty Lozano, brought to you by the Center for Biofeedback and Behavior Therapy in Addison, Texas.
Hi, and welcome back to the show. If you're just joining us, we're discussing pain management, back pain, and neck pain. That's a cake, Dr. Water. Let me get that for you. There you go.
Thank you.
We're discussing back pain and neck pain and the use of lasers, but really, what we talked about over the break is this is really redefining what LLLT is, because it's not really into the same category, same classification.
Well, this is totally different from LLLT. It's not a low-level laser therapy at all.
Yeah.
It's using combinations of high-energy lasers that are kind of infinitely tunable to accomplish a lot of things. And while you can get your face done and your body resculpted and so on, that's the ordinary thinking in people's heads about going to a cosmetic laser technologist. We're looking at it quite differently from the standpoint of scar pain, revision. There's only 3 or 4 machines in the Dallas-Fort Worth area to begin with, and we're working with some plastic surgery people and other people who have a background in radiology who are looking at different contractures of muscles and trying to loosen them up non-surgically. So the key word here is we're not doing surgery in the traditional cutting sense, although we are cutting with lasers.
It's like a rehabilitation of some sort, but
well, it is in a way, yeah.
Yeah, I mean, in that instance, but as far as like how it actually affects somebody's back and pain,
we won't know that for quite a while.
Yeah. Do you think that like what's happening is we're doing? What exactly is it doing? Is it deadening nerves? To lessen
we don't know. Nobody knows what the mechanism is.
So there's really nothing that you can compare it to.
Yeah.
Like it's not. It has like you can't say it has the same effect as like maybe an injection.
No.
Because,
not at all.
Yeah. So
not
this is very
totally
experimental.
Unexplored territory. In some ways, it's kind of premature because it's so new. But that's kind of my interest is in moving things forward in terms of looking at different approaches.
Yeah. Well, that's responsible for you to say, well, we don't know, because I think that, if you can't make a comparison, then that means it really, it's very...
No comparisons to be made. You have to organize studies. You've got to think about how you're going to design protocols. It gets to be a heroic undertaking, I guess, to just kind of think your way through how to do this.
So does it even have a does it have a classification? Does it have a name yet? Or, the treatment, this kind of, this approach or this direction?
Well, no, not really, because most of these cosmetic lasers are used for cosmetic and aesthetic purposes, and they've been used for 25 years.
Right.
But this is a whole new way of looking at cosmetic laser therapy and fine-tuning it, if you will, or adapting it for chronic joint pain, chronic back pain, neck pain, snoring, sleep apnea.
Mm-hmm.
And what prompted you to start looking at it for those things?
I'm sorry?
What prompted you to start looking at this treatment for those areas?
Just got interested in the idea that if low-level laser therapy has some degree of success, could other cosmetic lasers with different energy levels have the potential to help people chronically with pain, kind of in an attempt to get away from all the thinking about medications and opioids and so on.
Right.
I mean, that's part of it as well.
It's another direction to go in. And it has to be developed.
Right.
So where is this taking place at? Where are you guys doing these studies?
Right now the machine is down at Big Baylor at the plastic surgeon's office. It's a 200-pound machine. It can't be trucked around very readily, and it's so delicate that you really don't want to put it in a car and take it bouncing around town. Not at those prices, but we're keeping it there on North Washington. My partner's name is Emmanuel Ubinas, Ubinas, and it's on North Washington. I think his number is 214-824-7373.
And
I think
he's at Beauty Body Works.
The name of the company is Beauty Body Works, but we're actually doing business under a slightly different version of that name. And we're going to be opening soon, and hope to begin doing not only cosmetic and aesthetic laser procedures, but I hope to. I've got about 8 or 10 people booked for snoring and sleep apnea, not non-surgical. So again, this is not something insurances will pay for. There are no codes for this kind of thing, but the downtime is almost zero. The pain levels are zero or close to it, and we can make people very comfortable by cooling skin and doing all kinds of things. So it's again just a new way of looking at providing another service that could impact chronic pain patients.
Yeah, you gave me a flyer on this place or some documents on it, and it says here neuropathic pain, back and neck pain, arthritic disorder, joint pain, headaches and migraines, TMJ problems, snoring, sleep apnea. So yeah, this is right here in town, folks. I mean, it's the phone number is 214-824-7373, and it's there's a website, Beauty Bodyworks.
Well, it's being put together right now.
So it's pretty new. Yeah. But when it does come up, you can actually look at the beautybodyworks.com is when it's up and going.
Yeah, it's going to be actually the beauty has been converted to the Italian word bellezza, Bellezza, Bellezza Body Works. It'll be a kind of a DBA type name.
Yeah, got it.
The umbrella company is Beauty Body Works.
Yeah, I like that. Well, you're gonna have to keep me posted on that. That's I love the direction you're going in, and I mean it seems like it's gonna be a lot of a really helpful resource for people.
Know. I honestly cannot predict what direction it's gonna go in.
Well, and that's the thing. But somebody has to, in order for new things to develop in this world, somebody has to start doing it. You know, and then tracking the progress and see where it goes and that's how new concepts come about.
That's the underlying thought, yeah.
Yeah, but I'm really happy that this is actually happening in Dallas. I'm proud of you. I mean, it's you're always doing something interesting. I was like, what is he up to now? So that's great. Have you ever heard of any of this being used for kids that have difficulty eating or like with feeding issues?
No. Lasers have been used in part. Alongside of traditional surgical plastic surgery models for cleft palates and all kinds of things. I've gone on a couple of missions with the plastic surgeon, and he does them in Central America and so on from time to time. But I think that there's really no data on use of the lasers as a replacement for what, after all, has to be done surgically.
Well, and the adenoids, when they're large and swollen, that can affect, snoring, but also eating and swallowing.
Right.
So if it can be used for things like that, it can definitely start to help some of these kiddos.
And we do have a protocol that's been developed by the company, at least it's had some use, for sleeping and snoring. I snore myself. I don't have sleep apnea, and I've had a procedure done with this same photona laser technology, and I'm due for another one because it's a series of 3 treatments, and I don't know what the results will be on the snoring side, but certainly you're right. If you have, there are 4 categories of, I'm sure you know about them, where how much of the pharyngeal canal you can see, and it's stages 1 through 4. If you got a stage 4, your adenoids are totally obstructing your ability to breathe properly, and that can get worse at night. And it certainly has implications for swallowing, eating, and speech.
Yeah, people, I think, underestimate if you can't breathe, you can't do a lot of things, and one of those is eat. So it definitely impacts it.
Yeah. And you can't oxygenate your brain as well.
Right, yeah.
And your sleep patterns are so off in general, that's what contributes to the longevity and the persistence of symptoms with chronic pain. People 98% of people who see me for the first time have something wrong with their sleep pattern. And if I don't pay attention to that, nothing's going to move forward.
Boy, that's big. You know, I had a physician in a few shows ago discussing sleep and how important it is and how fundamentally that can cause so many issues and exacerbate symptoms and make things worse psychologically, emotionally, and, you know,
physically as well.
Developmentally.
Yeah, you know, as a child for sure, and how then the use of technology, like having like a bright light in your face, how there are two responses in the brain, one that's trying to stay awake, their circadian rhythm, and then the other is like the non-circadian rhythm that's trying to actually go to sleep, and it's like a tug of war. So if there's anything that jolts the brain out of that state, then, you know, a person will start waking up. And guess what most people have next to their bed? This little handheld computer that can take you anywhere in the world, you know, at any hour of the night. You can even watch movies on your phone now. And yeah, it's hard. It's a really, I think we're seeing an era now where it's really difficult to kind of, you know, separate those things. But how this will snowball into an effect of lack of sleep, snowball into the effect of more psychological issues and pain conditions, and exacerbate, you know, make things worse. So it certainly doesn't help. But I mean, there's a certain discipline when it comes to being able to, you know, keep yourself asleep and you know, be healthy. So we're going to take a quick break. When we come back, we're going to wrap up the show on this laser treatment and maybe talk a little bit with Jessica about what she does. We'll be right back after these messages.
The Russ Martin Show.
What are the little fish that hang under sharks?
The ones you always see like in Shark
Week. But what are they called?
Pilot fish? Pilot fish, yes.
Why are they called pilot fish? It's not like they're driving the shark.
No.
What are you doing? I'm driving this shark.
The Russ Martin Show.
Not to be left out, there's Leprechaun in the Hood, which came out in 2000, which was...
Oh, man, he had to have a field day stealing gold teeth.
Tomorrow morning, 7 to 11. Talk Radio, 1190.
Allergies. Pollen in the air. Dogs in the house. Mold in the basement. Whatever triggers your allergy symptoms, it can really hold you back. Break through with Allegra 5-in-1 Relief. Allegra works fast, won't make you drowsy, provides 24-hour multi-symptom relief, and it's effective every day. Break through allergies with Allegra. Starts working in 1 hour. Use only as directed. Guaranteed or your money back. Visit Allegra.com.
Why have over 3 million guys switched to Harry's razors? Because we make just one perfect razor with 5 precision blades. Ding! We own the factory, cut out the middleman, and sell our blades for half of other overpriced 5-blade alternatives. Now we're dropping the half-price sound effects guy.
Wait, why?
Harry's. One perfect razor. None of the extra noise. Visit harrys.com today and use code 1717 to get a special trial offer. That's harrys.com, code 1717.
Does your DWI conviction from years ago continue to disrupt your life? You may be able to seal that DWI conviction. Receive an auto-dialed text message from the law offices of Greg Ray by dialing pound 250, keyword DWI, or go to DWIsealed.com, Principal Office, Rockwall, Texas.
You're listening to the Therapy Hour with Rusty Lozano, brought to you by the Center for Biofeedback and Behavior Therapy in Addison, Texas.
Hi, we're back from the break. If you're just joining us, our show today was about low-level laser therapy, but actually it's not even low-level laser therapy. It's really high-level energy work. And just to kind of recap, if you haven't been listening the entire time, this group of doctors is they're repurposing a higher energy level laser for pain control and pain conditions, like, you know, addressing spinal injury, like back pain and neck pain, and it's very experimental at this point, and they have 1 or 2 patients that they're kind of following and as they're using treatments, but they're getting positive results. The center is here in Dallas. It's called Beauty Body Works, and it's going to change the name, but the phone number is 214-824-7373. And it's here in Dallas, right in Dallas, Texas. So John Paul Krusz is one of the doctors.
Big Baylor, yeah.
Big Baylor.
Yeah.
Yeah. So they're pretty open to this kind of. I mean, it's experimental. It's kind of you're carrying the flag on something new, different, and they're pretty supportive.
Yeah. Well, we're hoping to get people interested in our use of this. And
how did you get your first two patients? Just curious.
Well, one I happened to do during a training session about a month ago in Denver, and it's a whole training process to learn how to use the machine, and it just happened to be somebody who that particular doctor had scheduled because she had chronic neck pain, and he had never treated her before for it. So we just came up with this modified protocol that's used for other cosmetic purposes already, well used for a long time, and has good effects. But we kind of turned the power down and turned the particular frequencies to hopefully focus on what was, after all, the removal of a tumor from her neck 14 years prior, leaving her with daily neck and upper neck pain and pain between the shoulder blades and muscle spasm. And for now, at least for now, 4 or 5 weeks down the road, she still is telling this doctor that her pain hasn't returned.
Wow.
So it's only one patient. You can't make any comments.
Right,
really,
but it's like
based on that.
It's curiosity. I mean, you're like, wow,
Well,
what was it?
Nobody really got a pain history from her.
Right.
She wasn't being treated by a pain physician.
Right.
So.
Yeah. Wow. Well, at least maybe the word will get out and you'll have more people interested
It'll be
in
a
this.
slow go, but we're looking forward to playing with it. Yeah.
Absolutely. Well, I want to spend some time with you, Jessica. You're a new professional in the field. Speech and language pathology. You do pediatric speech and language pathology. And it says here you're a speech and feeding center at Frisco, but it's a different operation because it's actually out of your home.
Yeah, so it's I've been doing this. I've been a speech therapist for over 10 years and decided to start my own private practice. And initially thought, well, what about doing it out of my house? One that's easy to start and low overhead and that kind of thing. But really what it's been doing is kids don't have to go to another doctor visit. They don't have to have another clinic that they spend plenty of time in, and so they kind of feel like they go to a friend's house to play, and they're there getting some help either with speech, language, or feeding issues.
That's a really cool idea.
It's been great.
You know, we were texting the other day about what you do, and I like that concept of a home base. I mean, there's a few operations I've heard of that do some things like that, but having a home office seems like it'd be less clinical, and you could have a little bit more of a homey environment.
Well, and so for feeding therapy, I think people think about, okay, take a bite, you got to eat. Well, half the time to get to that point, you have to play in the food, you have to cook, you have to have this natural environment. And so I had a patient where his first therapy session, all we did was make banana bread in my kitchen. And that was the therapy session. And I think we underestimate how helpful that is, getting us to the next step, which is eventually getting to actually eat the food. But it's great for the kids to have that natural setting, doing natural things, naturally
and it has to be
food.
So less threatening than going somewhere and you're sitting in an office like in a strange place. Who is this person? What are they putting in my mouth?
There's a lot of fear. There's a lot of fear with food. The kids I see, they have a lot of fear with food, and so you want to keep everything else calm for them because they're already heightened sense of alert, and so it's helpful.
So I'm curious about something. My kiddo had swallowing issues at some point when he was, I guess it was maybe about 3 or 4 years back. The dentist put a contraption on the roof of his mouth, and it altered his speech, and and I think that's where the problem started. he was little. I think he was like probably in like first grade or so when they did this, and so then he had a lisp, and he couldn't swallow. But then when they took it off, because they'd done whatever they needed to do with that procedure, he had difficulty swallowing. And like the way that he would do this is he would actually fill his mouth full of food, and then like start swallowing a little bit at a time. And I wasn't sure. I mean, is it possible to unlearn how to have something that is so instinctual?
Well, so yes, actually, it's a natural reflex, but things can change that. Things like reflux can change that neurologically. Their mind just says, wait, I don't want to swallow anymore. It hurts when I do that. But in that case, it was a motor pattern got changed. The input that they got in their mouth was different. So then their body had to learn, okay, now what am I going to do to make my motor patterns work? And then they took it off, and then the body had to go back again and be like, okay, what am I going to do? And probably what happened was he wasn't getting the input he needed anymore once they took it out. And so he was overstuffing to get the input he needed to know that food was there. Once the body knows food's there, okay, now my mouth muscles know what to do. But he had to overstuff to get the motor pattern or the sensation for the motor patterns to work.
Yeah.
Jessica, is it easier to retrain an older child to change those motor patterns?
If it's truly a motor pattern issue, yes, because they can, like I have an older kiddo right now, he can do his own tongue exercises. It's great. Mom and dad don't have to do, one more thing before a meal to help him. He's great at that because it's truly a motor issue. But when it is really behavioral, the older they are, the harder it is. But a lot of times, too, because that fear is so high for them.
Do a lot of the original issues come out of cerebral palsy patients?
I have had a lot of cerebral palsy patients in my days. And those are hard ones because to change those motor patterns, it's, their gross motor, their bigger muscles are really the foundation for their smaller oral motor muscles. And so I can only do so much. I have to work with my physical therapy and occupational therapy friends a lot for those patients.
Yeah, I think that's what a great approach you have and a great service. Cause I think that's such a necessity because it's not always it's practical. Very very practical for training, very practical for teaching kids.
Yeah, I've loved doing it. It's been great.
How'd you get into this? You were saying earlier, before the show, you used to work at a NICU?
Yeah, well, so I used to work at Children's for 10 years. I've worked in their inpatient unit, their outpatient unit, their home health, kind of been through their system, both clinically and operationally. When I left there, I was in operations. And I kind of was starting to look at some other things, kind of what's next for me. And my husband's amazing and supportive, so I'll throw that out there. And he really said, I think this is your next move. And there's a lot of kids who don't get the services they need because there's a wait list. There's only so many after-school hours in a day, or there's not enough therapists trained in feeding. You don't get a lot of training in school for that. A lot of it's after school. Yeah. And so there's kind of a gap, and I was hoping to fill that gap.
Oh, that's awesome. Well, I like the fact that you have the home base, but there's so many different directions you can go with that. I see a bunch of mothers with strollers at your house. I can picture something like that.
Well, so they're like, well, I have the siblings. I can't come at that time. I said, bring them. I have a playroom. I have my living room. I have my Wi-Fi password. Bring the iPad. So siblings can even. It just frees up the parent.
Yeah, and I think that really helps to not have to find a sitter and worry about this. I think that's a really clever approach.
Yeah, it's great. And then I have a kiddo the other day. He wouldn't stop throwing things. I couldn't find something to do in my therapy room, so we went out on the trampoline. There's no trampoline in a clinic. So, well, there can be, but it has to be pretty big.
Right.
So it's great.
And the fact that it seems like you're going over to Miss Jessica as more of a friend than anything else. Well, I'd love to have you on the show and maybe have a show dedicated to you and what you do.
Yeah, I think picky eating is a topic that a lot of parents would love to hear about. You hear parents say, oh, my kid won't eat this, or he'll only eat chicken nuggets. And I'm right now doing a bunch of free seminars for parents just to help them learn about picky eating. I think that could be great.
How can people find out about these seminars, Jessica?
So on my Facebook, SFF-SLP is my name, Speech and Feeding of Frisco. On Facebook is where I post those. So there's actually one coming up Thursday. Is that the 26th, I think? I'm pulling up my calendar now. I should have been prepared on that one. Yeah, Thursday the 26th. It's actually going to be at my my house / my clinic.
Cool.
It'll be a free seminar at noon for moms.
Far out. So find her on SFF on Facebook. If it's for Speech and Feeding of Frisco, and then you and I'll have a show eventually. You know, talking about a topic, picking eating. It can be great.
Yeah.
And a lot of families would really turn into that. Well, listen, guys, thank you so much for being on today. Jean-Claude, man, I'm really impressed with where you're going with this. And
this is just very embryonic. I don't want to give anybody any false expectations, or myself as well.
Right.
But this is something I'll be looking at for the next several years, too.
And we'll keep everybody posted on that, and we'll have you back. I mean, you've been a regular and a good friend, and
thank you.
I appreciate you guys spending the afternoon with me. Have a great afternoon, and we'll see you guys next week.
Thanks, everybody.
Take care.